What does your mediastinoscopy pathology report mean for lung cancer? Imagine sitting in your doctor's office, waiting to hear what your recent mediastinoscopy revealed. That report holds vital clues about how your lung cancer has spread and what treatment options might be best for you. A mediastinoscopy is a surgical procedure where a small camera and tools are inserted into the central chest area to collect tissue samples from lymph nodes in the mediastinum, the space between your lungs. These lymph nodes are important because they often act as the first place lung cancer spreads to, and checking them helps determine the stage of your disease. The pathology report from this procedure tells your doctor whether cancer cells are present in those lymph nodes. If cancer is found, it usually indicates that the disease is more advanced, often classified as stage 3 or higher. This means your cancer has spread beyond the lung itself and might requiring more than just surgery, such as chemotherapy or radiation therapy. On the other hand, if the report shows no cancer in the sampled lymph nodes, your cancer might be at an earlier stage, like stage 1 or 2, which could make surgery a more valuable option with a higher chance of cure. The report will specify which lymph node stations were sampled during the procedure. It will note whether cancer cells were detected in those nodes, and sometimes include details like how many lymph nodes were examined or the size of the biopsies. This information helps your healthcare team understand the extent of the spread and plan the best course of action. For example, involvement of mediastinal lymph nodes is classified as N2 in the TNM staging system, which is an important factor in predicting prognosis and guiding treatment decisions. Knowing whether your mediastinal lymph nodes are affected influences your treatment plans significantly. If the nodes are positive for cancer, your doctor might recommend a combination of therapies to target the disease more effectively. If the nodes are clear, surgery might be considered with a goal of removing the tumor completely. Sometimes, mediastinoscopy is done after less invasive tests like endobronchial ultrasound-guided biopsy, especially if initial results are inconclusive or if suspicion remains high. It's important to remember that no test is perfect. False negatives can happen if not enough lymph nodes are sampled or if the disease is very small or hidden. Disease can also develop or progress between the time of staging and treatment, so ongoing assessment and a multidisciplinary approach are essential. The pathology report does not tell you about distant metastases, which are assessed through imaging studies like CORT scans or PET scans. In summary, your mediastinoscopy pathology report is a key piece of the puzzle in understanding your lung cancer. It helps determine whether the cancer has spread to the mediastinal lymph nodes, which influences staging, prognosis, and treatment choices. Positive findings often mean more aggressive treatment, while negative results may open the door for surgery with curative intent. Always discuss your results thoroughly with your healthcare team, as they can interpret the details in the context of your overall health and specific situation. Remember, every case is unique, and personalized care is the best way forward.